Good morning. Good morning and welcome, everyone. It's so wonderful to see you on this beautiful Wednesday morning. Good morning as we allow you to file into the space. We're always so grateful when folks take the time to join us here at the Foundation for Black Women's Wellness for our morning coffee and other events. So we're just thanking you this morning for being here. Good morning as we file in this morning. Lovely to see your names popping on the screen. Good morning. I won't roll call this morning. I have a habit of calling every name that I recognize. I won't do that today, but so grateful to see you all here. As you continue to come in, good morning and welcome to Morning Coffee. My name is Lisa Peyton-Caire, founder, CEO, and president of the Foundation for Black Women's Wellness. Here with our team members and special guests, here to welcome you into this space where our purpose is to empower a generation of well Black women and to build a community, a nation, and a world where Black women and families thrive. We're so proud this morning to be celebrating the 10-year anniversary of the Foundation for Black Women's Wellness and the second consecutive year of Morning Coffee. These talks were born at the height, yes, snap it up. These talks were born at the height of the COVID-19 pandemic in 2020, in May 2020 to be exact, as a way to keep our community connected and informed on key issues, to center ourselves in our collective power as Black women, and to call ourselves into action together and with allies and community to cultivate our well-being. In very intentional ways. And we're back in that spirit today to have a very urgent conversation that we know is on everyone's radar and top of mind. Black women deserve reproductive freedom. The impact of the overturn of Roe versus Wade and Wisconsin's abortion ban on Black women. And we have some incredible guests with us today. We're going to help us break this down. Our intent in this session today is to educate, inform, and to really consider the ramifications of the overturn of Roe v. Wade and Wisconsin's ban on the day-to-day lives of Black women. And that will connect with what's happening in other states. And to help me break it down today with me is our co-moderator, Katrina Morrison, who is our new and very first Director of Policy Advocacy and Outreach. She brings a wealth of experience in the policy space, and we're very fortunate to have her officially on the Foundation team and leading the way in helping us interpret, understand, educate, and do outreach and engagement around this crucial topic. Also with us today is four wonderful guests, Dr. Tiffany Green, Tamara Thompson, Michaela Berry-Smith, who's also a team member here at the Foundation, is our Maternal and Child Health Initiatives Manager, and Zakia Sorensen. And I will officially introduce them later in just a few minutes. So just let's snap up our guests who are taking time out of their very busy schedules to help us today. And I also want to nod Dr. Green once more, as we are partnering today on this event with the Black Maternal and Child Health Alliance. We previously referred to the Alliance of Dane County, but it's really the Black Maternal and Child Health Alliance of Wisconsin as that body continues to grow, shape the narrative, and lead the way in so many ways. We want to thank you, Dr. Green, and members of the Alliance who are on the call today, as well as Aaliyah Stevenson, who's also our Chief Programs and Development Officer and the co-chair of the BMCHA as well. Thank you all for being in the space. While we're waiting today, we want to hear from you in our chat. We want to know where you are, who you are, what organizations you're affiliated with, and how you're feeling on a scale of 1 to 10. In everything we do, the first priority is you and us, our well-being. And we want to hear from you this morning as many things happen in our community, our world, and personally. Tell us who you are. Shout us out from wherever, what city, county, state you're in. With that, we have a number of announcements we'd like to share first with you about the Foundation and our work, which is quite broad. And we're very fortunate to have Christine Russell, our Director of Health and Wellness Programs, here to give us a few important and exciting updates on ways that you can engage with the foundation. Thank you, Christine.
Thank you, Lisa. Good morning, everyone. So registration is now open for our 14th annual Black Women's Wellness Day. Now, hands raised, how many of you have or plan to register today for this very imperative event? Hands up. Okay. Excellent, excellent. So we will go ahead and put that registration link in the chat. Again, this is Friday and Saturday, September 23rd through 24th. We have a panel of wonderful guests joining us for this event. Next on our list, we have several action items that are going on today. So right after this meeting at 12:15, join us at the Capitol Rotunda for our Capitol Walkers. 12:15 here in Madison. This is led by our ambassadors. We would love to have you join us there as well. We have Body Groove this evening with Gayleen. This is a new event space. So at Veri Nicole's House of Beauty off of Park Street here in Madison, Wisconsin. It is a beautiful space to groove, to bring your family, and to enjoy some freedom this evening as well. Next on our list, we have Curated Calm with Irene this Saturday at 10 o'clock right here at the foundation. Now, this is July is actually Minority Mental Health Awareness Month. So we're doing a special class, a special curated class on Saturday to support and honor our own mental health and well-being. So please register and join us Saturday at 10. And finally, with regards to our events this month, we have our Well Black Woman Market, our second market of the year. Now clap it up, snap it up if you came to the June event. Yes, it was amazing. We have now doubled our vendors for July. We are so excited to be hosting them again here at the foundation. We have sea moss, juice infused smoothies, we have butters, we have creams, we have waist beads, so many opportunities for you to support Black entrepreneurs. So join us on July 30th. Now, with all of these events, we have so much going on, but we invite you to join us within our Mighty Networks platform, and we'll put a link in the chat for you to join us there. This is an opportunity for you to get real-time updates of all of our events, our happenings, all the things that we have going on, and connecting with individuals, connecting with sisters between these events. This is an opportunity for us to really connect, have further discussion around what we're hearing today, what we're hearing within our communities, and have a safe space to share that information. So join us, and I look forward to seeing you this month. Lisa, I'll pass it back to you.
Awesome. Thank you so much, Christine. As you all can hear, there are a number of ways for you to really engage and indulge in wellness and to support Black women in our community. Economic security is one of the critical centerpieces of our work and our advocacy. And one of the ways we do that, among many, is to support and promote Black women business owners in our community. And so please come out for the markets on July 30th. There'll be others as your dollars will be going directly to build the entrepreneurial capacity of women in our local community, which builds our local economy and stabilizes families. And of course, join us for any one of the classes that we offer weekly here at the foundation. Now with that, I'd like to introduce our panelists. And in introducing our panelists, it's impossible to cover the breadth and depth of work and leadership that each of these women bring to the table and exercise every day. But I'm going to do my best to summarize their affiliations as they work to inform us this morning on this crucial issue. And I want to start with Dr. Tiffany Green, who is the assistant professor in the UW Department of Population Health Sciences and Obstetrics and Gynecology. Dr. Green is also the co-chair of the Black Maternal and Child Health Alliance. Dr. Green is an economist and population health scientist by training and nationally recognized as an expert in racial, ethnic, and nativity disparities in reproductive health. And I could read a long list of affiliations. I know you have published work just this year, Dr. Green, around Black maternal and child health and reproductive justice, and you have become a pillar in our work as a partner and a leader statewide and nationally. And we thank you for being here this morning with us. Tamara Thompson is a doula, childbirth educator. Mother Earth Doula Care is her business, and she's affiliated with other organizations that many of you are aware of. She is a Black femme activist, lactation counselor, childbirth educator, and a student midwife. She is a founding member of the Wisconsin Doulas of Color Collective, co-founder of Harambe Village Doulas, a community-based doula organization, and of Maroon Calabash, a Black women-led reproductive justice organization based in Milwaukee. Her activism includes the intersections of pregnancy and racism, incarceration, trauma, gender identity, infant loss, economic status, and access to human milk, among other things. Thank you, Tamara, for being with us this morning. Michaela Berry-Smith is our very own program manager of maternal and child health initiatives here at the foundation. She brings to the foundation an impressive track record of work in the birth equity leadership space, early childhood education, social entrepreneurship. And for over the last 15 years, she has extensively worked and advocated for children and families in many diverse settings, and is the former co-executive director of Harambe Village Doulas. And on a daily basis, Michaela leads a very broad and growing body of work here at the foundation around Black maternal and child health. Thank you, Michaela, for being here today. And finally, but not least, is Zakia Sorensen, Outreach Manager with the UW Collaborative for Reproductive Equity, otherwise known as CORE. CORE engages in research and policy evaluation to address critical needs in abortion and contraception access in Wisconsin. Zakia plays a critical role in leading that mission and purpose for UW CORE, and is a wonderful partner to the foundation in our own work as we build out our policy blueprint for Black women's health. She has been walking that journey with us for nearly a year already. And her approach emphasizes reproductive and knowledge justice principles as a guiding framework for collective liberation. Thank you, Zakia, for being with us this morning. Before we dive deeper into our panel questions, we do want to make a brief disclaimer that the information provided during this event today does not and is not intended to constitute legal advice or an endorsement or recommendation by the foundation. All information and content are for educational purposes only. Of course, if you are someone who needs to follow up with us on anything shared today, please contact us at info@ffbww.org, and you can read that full statement in the chat. What I will say emphatically is that, with that being said, the foundation aligns with the principles of reproductive justice defined by our friends and partners at the Sister Song Reproductive Justice Collective and others on this call who are champions of it, who have led the way in our state. Defined as the human right to maintain personal bodily autonomy, have children, not have children, and to parent the children we have in safe and sustainable communities. We also believe that Black women deserve safe, affordable, and quality care that protects and preserves our lives, and we advocate for that each and every day, and treating us with dignity and respect, and honors our domain and dominion over our own bodies and our own choices. That includes equitable access to comprehensive reproductive care, including access to abortion care. Black women deserve to be heard and believed as the experts of our bodies, our lives, and empowered in our care as self-determined people. And now, before we hear from our panelists, I'm going to turn the stage over to Katrina for a moment to provide us a brief context of the meaning of the Supreme Court's ruling and implications for Wisconsinites, so that we are clear on what the law means and what it doesn't mean. Katrina, turning it over to you.
Hi, everyone. Thank you very much, Lisa. It's so great to be in this space and community with you all this morning. So I want to share with you a few key points that will really frame our discussion this morning. The first point is that on June 24th, as you all know, the Supreme Court ruled in Dobbs v. Jackson Women's Health Organization that the U.S. Constitution does not protect the right to receive abortion care. And so that decision overturned Roe v. Wade and Planned Parenthood v. Casey. This ruling abandoned nearly 50 years of precedent, making it the first time in history that the Supreme Court has ever taken away a fundamental right. And I want to be clear that this decision does not nationally ban abortion. Instead, it leaves it up to each state to allow, restrict, or ban abortion care. And so the second point that will frame this conversation is that Wisconsin is among 26 states that either already have or are soon expected to ban or severely restrict access to abortion care. So here in Wisconsin, we have an 1849 pre-Roe ban that is on the books and for all intensive purposes in effect. And so this law makes it a felony to perform an abortion, targeting providers. It does not criminalize the mother. It has no exceptions for rape or incest, and it has a very narrow exception for the life of the mother. And the third point, finally, is that there are several legal, public policy, and advocacy efforts underway to limit or stop the enforcement of this law. But as of right now, what's most important to know is that none of these efforts have successfully changed the status of the law. And with that, I will pass it back to Lisa to kick off our panel discussion.
Thank you so much, Katrina. We had a discussion yesterday with our panelists in lieu of today and talking about the importance of our community understanding the law, understanding what the stipulations are, and really understanding the uncertainty on how many of its components will be applied. So there's a great need to understand this personally, individually, as mothers, as birthing people, as grandmas, as service providers, social workers, educators, and as organizations who are committed to supporting women and birthing people and accessing reproductive care. So we urge everyone to understand that, and we invite you into ongoing conversations beyond today as we coalition build for solutions and shifts in the policy landscape. With that, we'd like to jump into question number one, and we want to start with you, Dr. Green. Let's start by laying the foundation for our conversation by referring back to reproductive justice and freedom. As I shared earlier, the definition of reproductive justice is the human right to maintain personal bodily autonomy, have children, not have children, and parent the children we have in safe and sustainable communities. So tell us a little about yourself and why being a part of today's discussion on reproductive freedom is so important to you personally and in your work, Dr. Green.
So in addition to being a huge advocate of the Foundation for Black Women's Wellness and all the work that you're doing, I do this work because I am a Black mother. I am a Black researcher. I am a person with a uterus, right? And so it's important to me because if we don't have reproductive autonomy, that's a fundamental human right and a fundamental human freedom. And that is something that has always been curtailed or denied for Black women and other people with the capacity to get pregnant, starting from slavery, when slave owners wanted us to have children to continue to produce a workforce. And then we have this pendulum swing to the middle of the 20th century where not just eugenics movements, but we have things like Norplant. And no, I'm not saying that, contraception is bad, but I'm saying coercive contraception is bad. Coercive contraception is bad. And so it's deeply important to me because I think when Black people win, everybody wins. And so if we can make life better for Black people, particularly Black women and other birthing folks, and babies and children, that's when we win. And so that's what keeps me up at night. And that's what keeps me going in the morning, knowing that by doing this work, it is fundamental for us to be able to achieve freedom.
Absolutely. Thank you so much, Dr. Green. Tamara, tell us about yourself and why this work and this discussion is so important to you.
I joined this movement really organically. I was a person who was in a support group circle for other Black women who were breastfeeding babies. And in the course of being in that circle, an activist woke up in me that said, where are my sisters in this support group circle that aren't coming back? And so that started a journey for me to become a certified lactation counselor, which in turn led me to become a doula, which in turn led me to become a student midwife. And so my interest is not only personal for myself, but also feeling very much like my sister's keeper, and also feeling very much connected to the concept that it takes a village to raise a child, to raise a mother, to raise a family. And so that is the main principle on top of reproductive justice, the lens that I do all my work through, that brings me to this work. And also recognizing that I don't do this work solely for me. I'm thinking about the future. I'm thinking about the future generations that are to come and what things must be true in order for them to reach their genetic potential, in order for the community that they live in to create the conditions for them to thrive. So I am 100% in support of the Foundation for Black Women's Wellness for having this conversation today, for bringing all of us together. And I'm really interested in, promoting the message. My personal message is power to the pregnant people.
Absolutely. Thank you so much, Tamara. There's so much to dig into, and I'm thinking now that there will need to be a part 2 and maybe a series to this conversation. So we want to just say that up front, that this won't be the last, because we certainly won't cover everything we need to talk about today. Michaela, good morning.
Good morning, everyone. I'm appreciative to be in this space with such beautiful minds and wonderful spirits. I was brought to this work because I think about my ancestors. I started my career in education, but through education comes the understanding of parental rights. And when you think about parental rights, you have to start from the beginning. And if we walk upon this land with the power to speak for those who did not be able to speak, and I don't make a change and I don't speak up and make some noise to make a difference, then the things that have been happening to our bodies for the last 450 years will continue to happen. And so that's what moves me. Seeing things happen to my own mother within just this past decade as a big sister, that's what moves me. Seeing how this now judgment will affect my children and their decisions moves me. So I cannot stay quiet, and I will not stay quiet until things are much better, not just for Black birthing people, but for all birthing bodies.
Thank you so much, Michaela. Zakia.
Thank you. I appreciate you putting this on today, Lisa. I think for me, I came into reproductive justice as a journey through my nursing career, from med-surg nursing and being dissatisfied about the system I was working in and wanting to work more closely with community, to becoming a public health nurse specializing in sexual and reproductive health, excuse me, and then being introduced to reproductive justice through that and through Sister Song, and ultimately recognizing the harms that we were still doing to community, and having my eyes open to not only what I had been through, but what other Black women were going through in the forms of reproductive oppression that I didn't have the language for, didn't actually recognize until I came to that. And so I come to this discussion not in any official capacity, but as a Black woman who's recognizing that we as a community need to have conversations around reproductive autonomy and around abortion, no matter how difficult, and recognizing that we cannot attain collective liberation by just picking and choosing which forms of oppression we'll tolerate and which ones we'll fight. And so just really wanting to be a part of this conversation and confronting all forms of that and working towards reproductive autonomy for Black women and birthing people. So thank you.
Absolutely. Thank you all so very much. Katrina.
Yes, thank you. So this next question is for you, Michaela. And I want to talk a little bit about reproductive oppression. So Black women's bodily autonomy has been systematically denied for generations. As Dr. Green had mentioned, from forced pregnancy during slavery to involuntary sterilization at the turn of last century, to the chronic undertreatment and undermanagement of Black pregnant people's symptoms. Why is it important that we center reproductive oppression in conversations about abortion access?
Thank you for that question, Katrina. I feel like if we don't center reproductive oppression in our conversation about abortion access, we lose sight of the reason why it's important to center Black birthing people when we're thinking about access to abortion care and to good abortion care. We think about the fact that systemic rape happened during slavery, and forced parenting happened without parental rights. You had no rights to your children, and you had no rights to whether or not you wanted children. To then sterilization during the 1900s up until even today, with women having their reproductive organs removed without their consent. We think about the idea of coerced contraceptives being forced upon clients I've had as a doula, just based upon their skin tone and their economic status. So if we do not center oppression, then we lose sight on the need and the reason why the fight for abortion care is needed. And we lose sight of the history of our country as well.
Absolutely. And I would invite other panelists to elaborate on that if you wanted. I know, Dr. Green, this is a big part of your discussions that you host nationally. I was listening to you just the last week. Can you dig deeper on just the irony of this history and now where we are today and why it is such a danger to the health of Black women and birthing people?
Yes, I think we get caught up in the morality of abortion. And what I would encourage people to kind of sit with a little bit is ask yourself why. This is why I have this very visceral reaction to what is a normal part and has always been a normal part of reproductive health care. So I teach a course in race and US obstetrics and gynecology here at UW. It's the first course of its kind. And we granny midwives, that's a whole other conversation that we could talk about later, but they've always provided abortions at great risk to themselves, because having a baby under coercive circumstances, particularly when someone owns your body, is critical, right? And so there's always been abortions in the United States, and understand that politically, this did not become a whole movement. This anti-choice movement is very bound up in the segregation movement. So understand that what we're seeing, this culmination of the anti-choice movement, is a movement to have dominion over people's bodies. And Black bodies have, and people have always tried to have dominion over Black people's bodies. And so I think that it's okay to sit with discomfort. And I think that's why the foundation is having this particular talk at this time. But understand that regardless of how you feel about abortion, I want you to dig into why you feel that way. And two, the whether you feel about it, have these uncomfortable feelings about it, restricting abortion hurts Black people. I mean, that there's no ifs, ands, or buts about it. We know that when Roe v. Wade was implemented, it disproportionately impacted Black women and people with uteruses. It benefited them by allowing them to have autonomy over their bodies, right? And we see abortion restrictions, they tend to disproportionately impact Black people. It tends to increase deaths from infant deaths from congenital abnormalities when Medicaid restricts abortion and states don't step in. We see increases in preterm birth, right? We know that it's predicted that there's going to be a 39% increase in pregnancy-related deaths. So you gotta make a decision. Do you care about an abstract idea of a baby? And I say this as a mother who would die for her children. Or do you care about the people that are carrying that baby and their bodily autonomy and their lives? That's a decision that you have to make. And it's hard, but I would encourage you to sit with that discomfort.
Thank you so much for that, Dr. Green. And we're going to dig deeper in a later question to you about the intersection of abortion care access and Black maternal and child health and the grave disparities we continue to face here in Wisconsin and across the country. There's a direct relationship that we need to clearly understand. For the sake of time, I'll move to the next question, but if anyone at any point wants to ad-lib a question, just do so. Wisconsin has some of the most pervasive and longstanding racial inequities among all states in the United States. We continue to rank in the top 5 for maternal mortality, Black infant mortality, and broad racial health disparities in general, including economic and social disparities, leading us, placing us in a state of being among the top in the nation for racial inequities across the board. Here, we know that Black residents are more likely to experience poverty and incarceration and less likely to have access to high quality healthcare or education or living wage work compared to our white counterparts. So Zakia, can you describe for us how these interlocking systems of disparity and oppression leave Black women and birthing people compromised in our ability to command our reproductive lives long before the Supreme Court decision just a couple weeks ago?
Yeah, thanks for this question, Lisa. So decisions about our sexual and reproductive health are based on these intersections of discrimination and oppression. So our identity, our access to resources, our communities and their conditions, our economic security and our capacity to access power, all of these impact the ways in which we make decisions about our reproductive health and care. So like looking at some of these systems that you mentioned, Black women in Wisconsin are overrepresented in the service industry and poverty wage jobs. We have less access to personal transportation, decreased ability for economic mobility, and less personal wealth. And poverty impacts our lived environment, like where we live, the amount of pollution, food deserts, over-policing, which criminalizes poverty and adds to overcarceration and the death of Black people. And where we live impacts our access to high quality education due to divestment in our communities. And Black children are criminalized at young ages, and our schools are punitive pipelines into the criminal justice system. So Wisconsin incarcerates 1 in 36 Black adults, and they account for about 42% of the prison population, while being about 6% of the total population. So our ability to access high quality healthcare can in part be due to poverty, being uninsured or underinsured. However, one of the real barriers is racism and white supremacy, and protective factors like education, geographic location, and income do not work when it comes to Black maternal mortality outcomes. And so Black women are not listened to, their pain is dismissed, and so are their symptoms. The way in which we are taught, nurses and doctors, and the design of the system they work in only serve to perpetuate these harms. That doesn't even cover our Black and our Black, queer, and trans community that has what they have to go through to get care. So from having to teach providers how to give you care, to facing homophobia and transphobia from people that you have to be vulnerable with to receive care. So all of these things will impact the way in which we make our decision around our reproductive health. Like I was saying, how the communities that you live in, your economic situation, and how you can access healthcare. All of these things will have an impact on you deciding if you want to have a child, not have a child, and your ability to parent those children in safe and sustainable communities. And so if we think about how all of this is going to impact somebody, bringing it back to Roe v. Wade, who wants to get an abortion in Wisconsin, we can think about it in this way. Like, For instance, in Milwaukee, the closest, if you're in Milwaukee, the closest abortion clinic is going to be in Waukegan, Illinois. There is no public transportation to Waukegan, Illinois. You will have to have personal transportation to get there. You will have to have a job that either gives you sick leave or will give you the ability to take time off, and you will have to be able to afford to take that time off. And if you need childcare, you will have to be able to find that childcare, and all of that takes money. Chicago is different. There is public transportation, but as of right now, you'll have to be there for 2 days. And this means, again, time off of work, money for transportation, money to stay, childcare, and can you afford to take that time off? And if you're on Medicaid and you unfortunately qualify to have an abortion under the rape or incest clause, you can go to Illinois and your abortion will be covered, but only if your doctor that you see is licensed in Illinois and in Wisconsin. And so once again, you're facing even more barriers. And that's just for an adult. Let's not forget our teens who have to face even larger barriers to get the reproductive health care that they need. And so how is a teen going to find transportation to get to Illinois or Minnesota, get the money and stay if needed, especially if they're not in a supportive family environment that will help them with the needs they have. And while we may think that medication abortion is an easy solution, we have to be careful about talking about that and encouraging people to just say, go buy this, the medication abortion and give it to somebody. If you give somebody the medication abortion pills, if you buy it for somebody, if you mail it into Wisconsin, those can be considered felonies. And so we have to make sure that the information that we're putting out there is not harmful to people who are trying to help folks. And so even having resources like the websites from Plan C is amazing and important, and they will actually vet their international pharmacies, but this still costs money. And what this does is it leaves folks that don't have access to money, that may not, that are poor and vulnerable and young, it leaves them open to Black markets that will open up under these. And what ends up happening is that you'll get subpar medication and you'll get medication that you don't know what's in them. And so this will definitely put people's lives at risk. And so what's really sad to me is that even if someone were to overcome all of these barriers to receive care, they still lacked a choice because they're living in conditions that give them little to no options around deciding to have children and raise their children in safe and sustainable communities. And that's how these intersecting systems of oppression will compromise our ability to command our reproductive lives.
Zakia, that is such a multi-layered, comprehensive answer that just continues to tease out all of the dimensions and tentacles of this ruling and how deep and far the impacts go. And I know our audience is deeply engaged and tuned in and hearing these complexities, not only for folks who need these services for any host of reasons, but also for those of us who are positioned to help and support. This law has made it potentially a crime to do so. And so understanding the sinister nature of decisions that place women and birthing people and communities in a position where the number of hoops and legalese to jump to secure basic health care is something that is truly standing out for me this morning. You touched on so many pieces, and we're going to talk about criminalization in this next question for you. Well, first with you, Dr. Green, and then with Tamara, who will follow. But lack of access to safe abortion care, as you said earlier, will further hurt Black people, women, birthing people with the capacity, anyone with the capacity for pregnancy and their families. Black women are 5 times more likely as white women to die during childbirth or within the birthing journey, more likely to give birth to children who die within the first year of life. And research shows, as you mentioned, that a total ban on abortion would impact and increase Black maternal deaths by an estimated 39%. That means in a state like Wisconsin, where Black women and birthing people are already more likely to die than our peers, that death rate will nearly double. What will these dramatically worsen health outcomes mean for Black pregnant people, for their families and their communities? Help us draw the distinction so folks clearly understand the intersection between Black maternal health and abortion care access.
Sure. Well, this is all really complicated, but Lisa, as you noted, we can sort of predict and estimate what these effects are going to be, and they can be very dramatic. But I also would encourage us to think about how we can mitigate these effects. So we know that restricting access to abortion is going to disproportionately affect Black people with the capacity for pregnancy, including Black women, and that's just a fact. We know that. But I think what we can think about is beyond that. So reproductive justice is also about the right to get pregnant and stay pregnant. And so what we also are seeing is, the fact that Black people are more likely to have miscarriages, right? And miscarriages are criminalized. We see that evidence now. So I think one implication that we haven't thought as much about is a potential for additional criminalization of Black people who are pregnant and lose children. We're more likely to lose a pregnancy, have fetal deaths, have miscarriages. So I think that's really important. And maybe Tamara can talk a little bit more about Act 292 as opposed to regulating Black bodies. But again, that is also a big risk. And I think the other risk that we don't talk as much about is IVF. So Black women are more likely to they're more likely to report having trouble getting pregnant. And we often go to get assisted reproductive technology when we can afford it later. And the later that you wait, the less effective it is. And even when we get ART, it's less effective. But now, people, the anti-choicers have given up the end game, which is also to give fetuses personhood. Well, what does that mean? It means that IVF is at risk, right? So now Black people have less access to ART, and on top of that, this, people, anti-choicers are trying to restrict access to ART. So that means that it's going to be more difficult for us to have the babies that we want. So ironically, we're talking about restricting access to abortion. This is also going to affect our ability to have the children that we so desire. And so I think, these abortion bans affect us across the reproductive cycle. As Akia talked about before, we're more, because of structural racism, we're less likely to have generational wealth. We're less likely to be able to afford to access abortions. And abortion funds, I'm a huge fan, obviously. They pay for so many abortions in this country that people cannot afford, but many of them don't pay for anything but abortions. And the very people that need these abortions need money for childcare. They need money to be able to take off of work, to take off of travel. And who's more likely to need those things? Black people. So I think hopefully my answer wasn't too scattered here, but literally these abortion bans affect us across the entire reproductive justice cycle, not to mention that forcing people to give birth is going to be linked to worse financial issues. And so instead of actually addressing the fact that people are in economic circumstances to say, I can't have this child, instead of fixing that poverty, we're like, okay, we'll just ban abortion, right? And so, I think there are effects. We're going to be seeing the fallout from Dobbs for generations. And we have to move swiftly to protect Black women and birthing people from these adverse effects. And so I'm sure people in the panel have other ideas, but that's just a few things that I've been thinking about the fallout of Dobbs for Black people.
Thank you
so much. Thank you so much, Dr. Green. As you had started to dive into a little bit there, and as the discussion has lended towards, is the criminalization of miscarriage. And so Black pregnant people are more likely to be targeted when abortion is criminalized, as you all mentioned, including prosecutions for miscarriages. Before the Dobbs decision, women across the US were already being jailed for having a miscarriage. And with the fall of Roe, prosecutions are expected to increase, especially among women who have an unexplained miscarriage. And so I want to quickly explain that medication abortion, which Zakia touched on, which is safe up to 11 weeks of pregnancy, initiates the body's natural process of miscarriage. So that means potentially that women who have a miscarriage or self-managed abortion could be at risk of criminalization. And even though Wisconsin's current abortion ban does not criminalize the mother, things could absolutely and very well may change. And so, Tamara, given the disproportionate impact of over-incarceration on the Black community, how would the criminalization of miscarriage or medication abortion exacerbate our state's existing inequities in mass incarceration?
Sure. Well, I mean, anybody who resides in a community that is already subject to over-policing and mass incarceration is going to see, those populations are going to see higher numbers. So I'm glad for this question in the first place, because typically that population is kind of out of sight and out of mind. And we live in a world where a lot of people have this attitude that anyone who's incarcerated deserves to be, and that the punishment that they get is well deserved. So if everyone on this call can, take a moment to confront that bias and reevaluate their values about what it means to be in prison. I want to tell the story of people who are in jails, people who are in prisons, people who are in immigration detention centers. And if they arrive pregnant, if they become pregnant while they're in there, those intersections are things that need to be thought about when we have these conversations. So already for people who are incarcerated, there's already this disjointed access to medical care. There are reports that document how people with chronic health issues already have issues with getting appointments in a timely manner, that already have an issue with their chronic health issues being maintained. And if they have, say, for instance, sickle cell, and they need to see a regular physician, there is all of this administrative backlog. There's difficulty getting access to the same provider every time who is knowledgeable about their condition. So we're already seeing that. And people don't normally think about reproductive freedom while in prison, right? So people who are arriving there that are already pregnant might have already had plans to terminate their pregnancy for whatever reason that they might have had. And before this decision was overturned, those people already faced a wide variety of barriers because of the way health insurance and things are paid for in that system. And ironically, imprisoned people are the only ones in the public who have a constitutional right to receiving health care, but actually being able to exercise that right is a totally different thing. So the main point that I wanted to make about people who have pregnancy while they're already in prison, right? We already know that there is a history of people who have been forced into sexual intercourse or coerced into sexual intercourse in the power dynamic of being an inmate versus a corrections officer. If those people are not able to access abortion care, then they're unable to also parent that child. And so we're creating harms upon harms upon harms for the person who is pregnant, for the person who is being born. And so without a viable journey or pathway to justice, we're creating trauma for those people, and we're creating people who are going to be born into this system and unable to break free from systems. On top of that, the law that criminalizes abortion care for people who are seeking it outside of the prison systems that find themselves inside of the systems will also have to face having to give birth within the carceral system. And so we don't see that people have access to parent their children while in them in the state of Wisconsin. I think there is a small number of people who have access to an outside facility, but it's not like in other states where we see something similar to like an institutional nursery where mom and baby or birthing parent and baby are able to stay together. So it's already, as you said before, Tiffany, the impact of this decision affects everyone in the whole spectrum. I wanted to talk a little bit about people who are pregnant having the leading cause of death of homicide. So for people that we already know are in prison for the act of defending themselves against their domestic abuser, if a person becomes pregnant and they know that they're in a very highly violent and abusive relationship, and they want to access abortion care, not being able to puts the very life at risk, and that risk is not even pregnancy related. And if that person decides to defend herself from her abuser, from her attacker, then we'll see even more punitive damages, even more criminalization on top of criminalization. So I just want to leave it there. I could talk for an hour about this particular subject. There's so many layers and there's so many nuances, Katrina.
Thank you, Tamara. Thank you so much. That was a really great analysis. Michaela, I want to go to you for this next question and really connect the big picture to the details of making meaningful and lasting change in Wisconsin. So the big picture is that both historically and presently, Black women have been subjugated to a byline in conversations about reproductive rights and access to abortion care. There is a clear need to shift the mainstream public discourse toward a Black womanist perspective that really underscores the sexual and racial differentiation and empowers Black women to be heard and believed as experts of our bodies and of our care. And so the details are that here at the foundation, our policy blueprint preamble, which was released last September, offers 9 pillars that set the stage for how we can achieve health equity in Wisconsin and how we can ensure sustained investments in the lives of Black women and families. So, Michaela, how do you envision the policy blueprint being used to promote Black women's reproductive freedom and social, political, and economic well-being?
Yes, thank you, Katrina, for that. And I love our policy blueprint that has been created here at the foundation. So many times people are asking, how can we get Black women to the table or Black birthing people to the table? But really the conversation should be people coming to Black women's tables and eating the food that we're serving, because we have the standard and the roadmap to what we need and envision for our own freedom, to have a well-being confronting the unacceptable racial inequalities and structural and systematic inequalities that we have here in our country that has compromised us for so long. And we all know that Lisa has the vision to make Wisconsin a better place for Black birthing bodies. And why not start here? Why not use our policy blueprint to change policies, not just here in the state of Wisconsin, which obviously we need, but nationwide and globally? It's not enough that we just make programs, right? Programs are the short-term solution to long effects, historical effects. But what the policy blueprint really writes out for us is, this is our standard, this is what we deserve, and this is what we are expecting from you. And if we continue to utilize the standards we have for us, it's not just going to support Black birthing people, but it's going to support all marginalized people. And so that's how I see our policy blueprint being utilized.
Absolutely. And there's so much more to talk about in that end as Katrina and others on our team begin to organize engagement around our policy blueprint, which we launched last year at Black Women's Wellness Day and have been feverishly developing out to really create a framework for Wisconsin, a roadmap, as Michaela said, because there hasn't been one. Black women haven't been on the forefront of policymakers' minds as they shape policies in our state. We've been on the chopping block for very long. And so stepping into that place of leadership, picking up where others have left off, following in the tradition of reproductive justice leaders like Sarah Noble, who is on this call, who I want to nod today, who is on top of my mind as someone who laid the foundation for reproductive justice in Wisconsin and continues to do that work through Be Noble. her new business that really is mentoring, supporting continuously in this arena. We thank her for being here today. And it really is that work and others' work that has led us to the place of recognizing that still Black women have to be at the helm of shaping policy recommendations and of doing the coalition building on the ground necessary to have a foothold to prevent this type of takeover in our state that limits our reproductive freedom and also connects the dots between the social, economic, political ramifications that impact and shape the way we experience life, opportunity, and access in our state. It was Loretta Ross who said something, and I'm not recalling the quote exactly, but in a nutshell, and we all know Loretta Ross is one of the co-founders of the Sister Song Reproductive Justice Collective and considered one of the co-founders of the reproductive justice movement. She said that choice is irrelevant without access. What is choice to women who don't have, access? If you don't have access, you can't make choices because socially, economically, politically, all the things that we've talked about in the course of this conversation, the intersecting points of not having enough, of not having the access to care, not having access to living wage, not having access to safe communities, not having access to all the resources required to make self-determined decisions about how you want to engage in your life in this world as a mother, as a birthing person, as someone building a family, when your basic needs continue to be unmet, particularly in the state of Wisconsin, where we see higher levels of poverty, higher levels of all types of systematic oppression that we've talked about in this call, from education to incarceration and everything in between. That is why this discussion is not just about abortion access, it's about reproductive freedom and justice and all the pieces that connect with it. And our policy blueprint is intended to pull all those dots together for a comprehensive approach to securing what Black women need to thrive in our states. So stay connected with us in that regard as we continue to build that out and to take steps forward in the policy space. I do want to return to Tamara very quickly, and today's morning coffee is going into the next 15 minutes. I'm on Eastern Standard Time, you all are on Central Standard Time, so I'm confused by looking at the clock, but I think 10:15 is your time there in Wisconsin. Tamara, we had a conversation yesterday that was so important, and you really gave a living example of a mother that you are helping right now that really draws clarity on the potential consequences, and really not potential, the very real and active consequences of this Supreme Court ruling in Wisconsin's abortion ban in the case of this young woman who you are assisting right now today to try to find a solution. Can you break that down for us so everyone understands the complexity in real time?
Yes. Monday afternoon, a 24-year-old Black woman went to a regular clinic visit, and she was told that I'm so sorry, 1 second. Okay, thank you so much. So she was told that her 6-month-old unborn baby had no heartbeat. She was told at the clinic that she would have to carry her baby full term. And this 24-year-old Black woman in the city of Milwaukee was looking forward to this baby. This is her first child. She's looking forward to holding this child, naming this child, celebrating all the milestones with this child, and then to learn, one, the tragedy that the baby is no longer living. She cannot expect to hold this child in her arms, but then the ongoing issue of, I'm going to have to carry this child inside of me that is not living for an additional 12 weeks, and the trauma that that will cause. And so the confusion, the chaotic thinking, the panic, I got all of those things reaching out and just trying to find a network of people who actually make sense to be able to understand how is it possible that a I'm so sorry, that a provider could look a young woman in the face and tell her that this is her reality, that this is what she's going to be forced to undergo, and that she is going to have to wait, knowing, thinking every day going forward, all of the consequences of this provider not being able to give her potentially life-saving care. What I know, I'm not an obstetrician, I'm not a doctor, but I am a student midwife, and I am very well read on things that have to do with obstetric care. So what I know, just being a non-medical professional, that the risk is very high for developing an infection. And so this is playing Russian roulette with someone's life. This is playing Russian roulette with someone's mental health. And so yesterday, on the call with folks yesterday, I'm networking, I'm trying to find who can help, where to go, who are the safe people? Is there a hospital that is not under religious directives that are considering an induction for a fetal demise to not be an abortion? And that is something that people don't consider when their ideologies clash with actual reality. So a part of my storytelling in that is to also consider the happy couple that goes to find out that their baby has a genetic abnormality that's not compatible with life. Right? And when those people go to their obstetrician and find that out, they have some options available to themselves that they could carry that pregnancy full term. And at any given moment, the baby will stop living. But if they were to have the baby come a little bit sooner, they can compassionately meet their baby, hold their baby, see them while they're alive, and say goodbye while they're living. Hold their hand, kiss them, give them a little bit of milk before they pass away. And that is compassionate care, but however, it falls under abortion. So I want everyone to think about not only this case here in Milwaukee, that I'm gonna get off this call and do some more legwork and get myself to Milwaukee to provide help and support, but I also want people to think about all of the things that intersect with these bans and how they touch real lives, not just numbers, not just rhetoric, but actual people.
That case struck us so hard yesterday, Tamara, and we're getting the calls as you're getting the call. And let me just pause to thank God for Black doulas, Black midwives, Black birth workers, and all doulas, midwives, and birth workers in our state who are really the first line of defense and protection and resource for women and birthing people in our state, and the need is higher now than ever before. And I appreciate so deeply you and all the doulas on our team and in our network.
No, thank you. I'm so glad that I have people that I can call and text message and say, this is happening now. I could text Katrina and I could say, what are the laws? I could text Sarah Noble and say, who are the people to go to, who are safe? There are people that I can call and say, this person is Black and we need to make sure that they get the care that they need. And when we see all of these hospital systems that seem inconspicuous, they might not have a very Catholic or religious name, you still got to do your research and understand and know very carefully that sometimes they're not practicing medicine first, they're practicing their religious directives first and medical care second. And what spaces do we need to avoid? And what network can we create to make sure that people know the safe places, And it's, as Black people, we have a genetic memory of what the Underground Railroad looked like, of what it looked like for there to be a candle in the window and know that we could go there and we could get rest in their barn, that we had to be hidden and stay away from people who were tracking them. And here we are in the spirit of Harriet Tubman, trying to get people to where they need to go. We're trying to create this, and it's just, I'm grateful to everybody who answered my calls and text messages yesterday.
Absolutely, and one of the things to drill down, the part that struck, struck so deeply was hearing that the hospital closest to her will not give her the care that she needs because of their own fear of the legal ramifications and because of their religious directives, both together, one sometimes superseding the other. But that if she does find a provider somewhere who will conduct, or if she could find a provider who would conduct it, that there has to be a physician who approves and then 2 other physicians who also approve. And Katrina, you can break that down for me, but it places the full decision and assessment of what that mother and birthing person needs, places it squarely out of her hands into the hands of someone else to make that decision and about its appropriateness for her. And she's waiting with the fetus in her body that is no longer alive, with no understanding of where she can turn or what her options are, except to go on and continue to carry this pregnancy, which may poison her body, which may cause her harm, which could kill her, but she has to wait for others to make the decision for her about the viability of her getting a procedure that should be her choice to access and to follow through on.
Yes, bureaucracy has entered into the uterus, and it is a crying shame. So I'm grateful for that. I want people to also think about the opposite end of this as well. Tiffany Green talked about it briefly, but it's Act 292. Where there are fetal personhood laws, and we could see how easily people could misapply laws that are meant to protect children by assigning a fetus as a person and using the laws such as child endangerment or child abuse against a pregnant parent for their unborn child. And so this is the absolute extreme. This is the absolute extreme that this person goes to get regular medical care, finds out that her baby is not living, and that the fetus that is no longer living has more foresight or thought than the actual person who's come to get care today, whose insurance is being charged. So that's just a couple of things I want people to keep in mind. I'm trying to fuse in, giving a lot of information with storytelling, with facts, with reality. So sorry if I'm coming at it really hard today.
No, we need to come hard. And this just underscores the urgency of the work, the conversation, and segues so well into our last question, which we want to hear from each one of you on solutions and actions and which direction we take. And first, I want to thank everyone in the chat. I've seen the massive number of comments, the massive number of pieces of information about what's happening in the landscape with hospitals and across our state, the barriers to care for adults, for teens, all the complexities along the way. And there's so much thought leadership, so much knowledge in this group that I really want to emphasize that beyond today, this conversation will continue. If you've not signed up yet to be a part of our listserv, we ask that you do that. And if our team can pop in the link to our listserv on our website where folks can join our mailing list, because we will be working diligently to create coalitions and partnerships and strategies to really address the impacts of this ruling to ensure that we have what we need and that we're building the momentum, you all, to be able to challenge what has come to bear in our state and across the country. And you used the words, Tamara, this is extreme. We know that the extreme is not off the table. We know that whatever we see as truly extreme that we could never fathom would become reality is very possible with decision makers who oppose women's reproductive freedom. And so if we think this is a challenge right now, there is far more in store if we're not prepared to meet it with some organized challenge. So with that, we ask you to join our listserv so you can be informed of our efforts to co-plan and mobilize solutions on the ground. So solutions. Wow, and there were so many of us yesterday who really did admit that we're momentarily perplexed, right? When we think about the solutions that are needed, they're needed on so many levels simultaneously at the same time. And so moving beyond being perplexed as we're getting phone calls from people who immediately need help in interpreting the ruling and understanding the legality and keeping communities safe and ourselves safe as organizations. There are many, many things to work through. But for now, let's discuss Dr. Green as Black women, as birthing people, as allies who are fighting to protect reproductive freedom. Where do we begin? And how do we mobilize to defend bodily autonomy of Black women in this terrain?
I think about this a lot because, a lot of people have rightfully critiqued the Biden administration for not doing enough out of the gate. But the reality is that administration's options are somewhat limited. And a lot of this fight is happening at the state level. I think one of the most important things we can do is in spite of the state being gerrymandered, we need to flip the legislature. We need to flip the legislature yesterday to really push through legislation that's going to protect the right to access safe and legal abortions. I think a second thing that we must do is support abortion funds. They've been doing a lot of the heavy lifting, and folks like Laurie Bertram Roberts in Mississippi and other Black women and femmes have been doing this work forever. They know what to do. We don't have to reinvent the wheel. Give them money and let them ride. Give money to the doulas and let them do the work that they do. And I would also say encouraging, and I'm trying to reach out to some funds here to make sure that they are providing, they're not restricting abortion funds to just focus on the abortions themselves, but also expanding to cover other needs, like the Yellowhammer Fund does in Mississippi. So yeah, I think those are a few off the top of my head, things that we can do right now. Obviously, if you are a clinic escort, you want to be a clinic escort, I've done that before. For those clinics that need them, that is a valuable service, but please don't go and protest at clinics. The idea is that we're there to support the people that need these abortions and not kind of go and fight with people. So I think for me, those are the three things that I can think of really that are important for expanding access to care. Basically, they end up with giving Black women money to do the work.
Absolutely. Zakia, what are your recommendations for what we do?
Yeah, I think that's a great question. We were talking about that yesterday, and as you said, Lisa, really kind of trying to figure out where we go from here. And long term, I 100% with what Dr. Green is saying about flipping the legislature. And then there's the short term of what do we do and how do we mitigate the impact that's going to be happening primarily with Black birthing people. And for me, one of the things that I've been thinking about is really the need to start at community levels and really starting to support each other there, not waiting for larger policies to move forward or to help us, and not that we haven't been already doing this. Like, we have the community-based organizations, we have the foundations for Black women's wellness, and we have the Black women who have been doing this work. But I think we really need to understand that it's going to happen within the community. We need to find each other, and Black women are everywhere in these spectrums of work. Like, for instance, you have Courtney Hayward, who's in Planned Parenthood, and we get so much of our information from them. And it's so important, the work that she's doing. She is she's the government relations specialist at Planned Parenthood, brilliant. And she centers constantly Black women. And, you have folks like Sarah Noble, who can get you in touch with all of these other folks that are on the ground doing work, because she has those connections. And I think we need to find each other and make those connections with each other, have these conversations, and start supporting the work from the ground up. And I think that's really where we're going to see more of the support coming from, and definitely supporting doulas and midwives, Black doulas and midwives. And when I say support, I mean money, not talking and not saying y'all are great, but money. And I think funding, like the funds are really good, and supporting those funds, like Dr. Green said, but I think it's also important that maybe we need to start looking at funds for Black women, Black birthing people. Like, how do we start making sure that we are taken care of and we are protected? And so those are the things that I've been thinking about.
Absolutely. Michaela.
I test everything that's been said. I align with it. I mean, the solution is not new, and it's just encouraging and supporting what's already happened. Black women, Black people, we're going to do what we need to do in order to care for one another. Unfortunately, sometimes the funds aren't there. And so really bringing home the need for more money to support us so that we can continue to support us. And I also think that as we wait for legislation, because we know that that's not going to be something, unfortunately, that will happen overnight, the solution is to support those that are already doing the work and that have been doing the work, not just by a pat on the back, but put your money where your mouth is. And I also think that we have to educate. A lot of times, pregnant people don't know what they're allowed to do. They don't know where to go, and they don't know who's safe, just as Tamara had mentioned earlier. So really being able to provide that resource to people and get them to the resources and the solutions that will help them in the now, just as Tamara is working on. So, you know, we can't think about like, oh, the future, yay, let's see what happens. We have to act now because things are going on right now.
Absolutely, Tamara.
I think everybody getting clear on their values, do a values clarification reflection moment or exercise amongst yourself, and then identifying what are the things you can do now in the short game and what are the things that you can do in the long game. And once you realize what those limitations are, then you can figure out, I can help someone else do that. I can't do that, but I can do this. And I think every single person saw what happened during the uprisings of 2020, mutual aid. Mutual aid is what Black women and Black people decided to do to take care of ourselves. And so mutual aid is going to be one of the most important things people can do, is to take care of each other. And once people are thinking about people in their own lives that are pregnant, how you talk to them, how you move around them, how you support them, how you help them get through what they need, as well as organizations like Maroon Calabash that has a mutual aid fund that will go to that person's house and drop it off at their front door, that will talk with them on the phone, that will be with them and hold their hand while they get the care that they need. So that's one of the things. And as Michaela was just saying, education, I'm willing to talk with people about their fertility. I will have the conversations in their living room around their coffee tables about how to become pregnant when you want to and how to not become pregnant when you don't want to. And understanding how your body works is going to be really key and important. And even for people who don't own uteruses, for the men too, they are fertile as well. So having conversations about reproductive health, reproductive justice, reproductive access are going to be really key and important. And I think that's one of the solutions that we can do in the short-term game, as well as was mentioned earlier, flipping that legislature. There needs to be more people that, once we understand our limitations, talk to someone else about what they're doing, what their program looks like, what their initiative is doing. If they're grassroots and their boots on the ground and we can't do that, give them a few dollars, talk to your friends, give your friends a word up, give these folks a few dollars.
Absolutely. And we're going to go back and compile these solutions and recycle them somehow in our communication with you all. We could go on and on and on, but I think the big message is it's up to us. Our survival and our persistence as Black women and birthing people and those who care about us is really resting on our shoulders, as it always has been. And that will be the powerful answer and solution for this and all the challenges that we continue to face and to overcome. No one else is going to do it for us. Thank you, Courtney Hayward. Your name was mentioned. We see you in the chat, our friends and partners at Planned Parenthood. I ditto what Zakia said about your work and the centering of Black women and always walking alongside us. Thank you for so many others who've been in the chat today, giving your resources, your insights, your comments. Thank you for those who joined us beyond Wisconsin. As you're navigating the space in your states and vicinities, please reach out to us for information sharing. If you're a woman on the call or birthing person who needs insight around what the law means in your state, please call Katrina. I assure you she can break it down for you, which is her expertise. As we're also looking and watching and learning and following and tracking this very closely. And one thing to know that the opponents of choice and access and reproductive freedom have been very strategic and planful for many decades. Many, many decades of strategy and planning have gone into the overturning of Roe v. Wade. And I would lead us in saying that whoever we are, Black women, birthing people, white allies, and anyone else, if we stand in support of Black women and birthing people and of women and birthing people and our right to conduct and command our own lives, choices, and decisions, we've got to do this in part together. You got to get over our BS. You got to get over our own biases, our racism, our classism. You got to get over it because our collective survival is on the chopping block right now. And the only way that we will see sustainable long-term change is if we take the two pieces of Black women leading what we feel is most important and joining that with folks who support us in that work, and the ways that those concerns intersect as women and birthing people across the board, we won't get to the finish line. We won't get there. So a big solution is coalition building, cross-sector, cross-community, cross-racial, cross-everything, coalition building. We need that in Wisconsin like yesterday, or our future will continue to look the way that it does today. And I know none of us want that. So please connect with us. Please follow our social channels. Please sign up for our mailing lists. The urgency is here, and we open the door to everyone and anyone who authentically stands with Black women and birthing people in this work. We invite you to consider ways to partner with us for our collective liberation. With that, we want to thank all of our guest panelists today. There will be a part 2 and maybe a part 3. There will be statewide and countywide engagement around this and other work that we're doing. Please connect with Katrina or broadly with our info@ffbww.org email address, and we will certainly circle back to you. With that, we will close as usual with know thyself, love thyself, heal thyself. Our wellness and our survival starts with us, and we already have the power. And with that, remember to be safe, be healthy, and be well. And we will see you all next time. Thank you so much.